All right, welcome back. Of course, this is the time that we want to spend some time to talk about the latest and what is informing conversations in the country. And now that we know that we have 26,928 infections, it's time that we want to speak to the Chief Executive Officer of the Kenya Medical Practitioners and Dentists Council, that is Daniel Yumbia. Good morning, sir. And as we do that, I want us to take a look at a chart that we have prepared here that would show the cases on how they've been rising since the 13th of March. If we have that chart to see how the cases have risen from the very start to currently now that we are reporting about 4,383. So you look at the very start, we had single-digit infections. Then starting at about the 8th week of infections, we had 207 being reported. So that has been rising consistently from week 12, actually week 11, that's when we hit 805 infections per week. And rising to 17th week, we had 3,245, then 4,250. The previous week before last, that we had 4,450 infections, and the week that concluded on Sunday, we had 4,383. So it appears that the numbers took a dip just slightly, with about that should be about 67 infections short. Let me begin by asking you the question about the testing that we are seeing in the country. Are you confident now that it's depictive of the actual situation on the ground, whether it's in Nairobi or even the rest of the country, based on the amount of testing that has been going on?
Good morning, Sam. Admittedly, we are not yet there. The testing which is being carried out across the country still needs to be strengthened. There are certain counties which are experiencing challenges. Once they collect samples, some have indicated that they are taking about 4, 5, 7 days to get their results back, because they are sending their samples, some to Nairobi for processing. So it's high time that we strengthen the counties to ensure that once samples are collected, the labs within the counties can be able to process these samples and be able to process the results in good time. However, I must say that we've done much in terms of testing, and the testing is a reflection of the situation on the ground. But I would appeal to people who feel that they need to be tested to go forward, to move forward and get tested. The counties have got approved testing sites. The Laboratory Technologies Board has approved a number of laboratories that can carry out testing, and some of them have not utilized their full potential, probably because of challenges of samples and the reagents and so on. So I would just appeal that if the counties can strengthen the process of testing, this we are calling targeted testing. Not everybody should go for testing, but we are looking at people who have recent infections, or people who feel that their body temperatures are going high, or people who have been in contact with others who have tested positive. These are the people we are encouraging to go ahead and carry out targeted testing.
Right, CEO, and there lies the challenge, because looking at the statistics from the Ministry of Health, it shows that 93% of infections are actually asymptomatic, meaning that they didn't depict any symptoms leading to their testing, and therefore it might be a challenge if you have to require people who are showing symptoms to go for that testing. How effective is the strategy that the ministry is using and yourselves in ensuring that you're able to control this spread, which could also be being pushed on by people who are basically asymptomatic?
As government, we are appealing to people who have been in contact with others who have tested positive to go for targeting testing. The infections are already within the community. So we are experiencing a lot of community transmission, and therefore we feel that people should declare their immediate contacts. If somebody has tested positive, it's only fair that they take up that step and move forward and get tested. As you will recall, there is a lot of blame sometimes from people who test positive. There is denial in the first place, and people feel that they are not positive while they are positive. Others feel that their results are negative, and therefore they throw their cares to the wind. They don't take precautions any longer. So we are seeing a lot of transmission within the community by people not taking up their personal responsibility. And today, I would like to move to a document that we prepared in the year 2013. We call it the National Patients' Rights Charter. This is a document that that talks of the rights of the patients. It also gives the responsibilities of a patient. And I would like to say, I'll translate it from the right of a patient to the rights of a citizen and the responsibilities of a patient. While it is a right for every Kenyan to get to access health, and while it is a right for every Kenyan to receive emergency treatment, and the right of every Kenyan to choose a healthcare worker of their own choice, they also have two responsibilities that I would like to talk about today. One is the responsibility of a patient or of a Kenyan to take care of their own health by adopting a health lifestyle that is acceptable. And the minister or the CS for health has continuously called upon Kenyans to adhere to the Ministry of Health set guidelines in terms of social distancing, in terms of wearing masks, and in terms of avoiding gathering or assembling in places that are not designated. So for me, I would appeal to Kenyans to know that they have a responsibility to take care of their own health. And by taking care of your own health, you have a responsibility to protect your brother, your sister, your mother, and your grandmother. The issue of Kenyans.
Indeed, let me finish
Mr.
Yumbe, if I may cut you short because we need to rush because of time. I'm just wondering about the testing that you said that you're encouraging counties to make use of the facilities that they have. I'm just wondering, what are you doing to the cost of testing? Because several of these counties, you'll find that the private laboratories will have the testing facilities available, but then they are pretty expensive. Is there anything that the government is doing to ensure that the common mwananchi who may be a contact gets faster service as soon as possible?
Yes, the common mwananchi has not been charged for testing COVID. What is happening even with the counties which do not have the laboratories to carry out the tests? The samples are collected and they are sent to the national laboratories, including KEMRI, and the process is free of charge. So there is no common mwananchi who has been subjected to pay for COVID testing at all. So that is basically what the national government is trying to do to ensure that the process of sample collecting is the responsibility of the county government, but where the county government does not have the requisite laboratories to test, the process of transporting the samples to Nairobi or to our branches like the Western to Kisumu, the coast in Kemri, in Kilifi, and those that are near Nairobi to bring to Nairobi. That is the practice. But what we are looking at now is to strengthen those laboratories to ensure that the testing can be conducted at the source where samples are collected. Because as you realize, once samples have been collected, the processing of those samples must be within a time limit, and the care and the transportation is of key importance to us.
All right, Mr. Yumbe, let's talk about the situation with the home-based care, because we know that majority of patients are recuperating from home. As of yesterday, 967 were still admitted in hospital, about 49 in ICU. So how is this going, especially in the counties that are now reporting new cases? Because now, understandably, every other county has reported a case. How is home-based care going?
Home-based care is a process that we approved as government, and the Ministry of Health together with the council developed these guidelines. And this is a process that is really helping a lot. But it also has its own challenges. One, I would say home-based care is for those people who have facilities that we have recommended, that you can have your own bedroom, you can have your own toilet, and you can keep away from the rest of the family. But while that is happening in most of the cases, that some families can comfortably isolate themselves within their home setups, there are also families within the informal settlement areas where home quarantine or home isolation cannot work. And as a result, we have identified a number of institutions. I did indicate that we now have 44 Kenya medical training colleges, which are spread across the country, which we have designated as isolation sites or isolation centers. These can accommodate a total of 3,200, approximately 3,200 patients or persons. And as a result, we have given that as a first support to the county, so that any county which has challenges in terms of people who cannot be isolated at home, they can be taken to these Kenya medical training colleges for isolation. We have also encouraged counties to set up their individual institutions, and some have gone ahead and established certain schools, and there are some schools which are being prepared or which have been set up for persons who cannot go for home isolation, so that they can go and stay in those schools for the period that is recommended. And that is one step that we feel is going to address the challenge. But the people who are going for home isolation, that those that can keep within their homes and they have no symptoms, we are encouraging them to stay at home. And that is basically what we are trying to do.
Okay, all right. As we end up, Mr. Yumbi, let's talk about the situation to do with the disposal of bodies of deceased persons that may have died from COVID-19. And we saw that very heartbreaking story of a Kisii family saying how they were tortured and how their mother was being buried. Exactly how is this supposed to be? Because you've seen several images of government officials or would-be government officials going to bury the dead in a very disheartening manner. What exactly is happening? What is the guideline?
Well, the guidelines have been set that once you die out of COVID-19, there is no way the Ministry of Health will allow the family to get into contact with the body. And you do know, we respect the traditional rights and the practices of each community, and every community have their own processes of handling the deceased. And therefore, it's quite an emotional situation, Sam. I must say that families are not taking it comfortably or happily, but in as much as we sympathize with the situations, sometimes we use utilitarianism, which states that enact is good insofar as it brings greatest happiness to the greatest number of people. Otherwise, it is wrong. Therefore, the public health officials may be seen to be doing something to the extreme, but on the other hand, they are doing that for the public good. So you see, we are also torn between the two competing interests. One is to adhere to the societal commitments and practices that have been with us over the years. And we are also pushed to ensure that we protect the same society, because once you let a victim or a body that is infected to be handled carelessly, then you infect the same family, and you are likely to get additional deaths or additional casualties in that particular family. Therefore, as health workers struggle to balance the emotions and the cultural practices and protect the society, we expect a lot of rifts, and therefore we will handle and investigate any cases that may have been extreme. I'll just caution that both parties, the community,
all right. Thank you so much,
and health
Daniel
workers
Yumbi, the Chief Executive Officer.
Must come to a point of reason. Yes? Yes, Sam?
Okay. All right. Thank you so much, Daniel Yumbi, the Chief Executive Officer of the Kenya Medical Practitioners and Dentists Council, for speaking to us about the state of response in the country. We now take a short break. On the Senator of Nairobi, Johnson Sakaja, as well as Vania Kibui, who is a policy specialist at Y-Act, will be speaking about the youth agenda in politics, economy, and health at a time that the world prepares to mark the International Day of the Youth. And that is tomorrow. We're back in a moment.